right, good morning, everyone, and welcome to the live session, Mental Health in the COVID-19 World. I want to introduce our panel this morning. We're very excited to talk to all of you about this, but it is a heavy topic today, and we did want to warn everyone that we will be discussing mental health and suicide. So if this is something that may be a trigger to you or someone in your household, please be aware of that as we move forward through this event. Also, it is very important to note that while these are experts in their field, this is not medical advice. And if you are in need of immediate medical attention, please seek it out as soon as possible. And if you are in crisis right now, please note that the suicide prevention hotline is available, and that number is 1-800-273-TALK-8255. And we'll post that throughout this event. So let's go ahead and introduce our panel here as we kick things off this morning, and double checking that we're up on Facebook Live, where you can share questions with us, and our other YouTube platforms. And it's not showing me right now, but if it is not, we will get it up there as soon as possible, and this will be recorded and shared on YouTube as well. Okay. Well, if it is not on Facebook, it will be on YouTube Live, and we'll share that on Facebook. Facebook has been having issues this week. It has stopped many of us with pages from posting, but we'll keep going and post it up that it is on YouTube. And it is on YouTube, correct, Steve? Okay. We will share the link on our Facebook page as well. Why don't we start with Rio? Can you give us a quick introduction and we'll keep things rolling?
Sure. My name is Rio Corbin. I'm a school psychologist with the Independent School District.
Carrie, then Heather, then Matt.
Hi guys, I'm Carrie Bond. I am a therapist at Comprehensive. I'm the director of outpatient services and a trauma therapist.
Heather, I think you're still on mute.
Can you hear me now? I'm Heather Hayes, the co-responder at Comprehensive Mental Health with the Independence Police Department.
I'm Matt McLaughlin. I'm a police officer with the City of Independence and a longtime crisis intervention officer.
All right, so let's get right into some of the things that we wanted to talk today. And Carrie, can you tell us what are some of the mental health flags that we can look for in ourselves and our family members and friends right now?
So I think right now, it's a really overall stressful time. We're dealing with all of the fears and stress that go along with COVID, and with the with some of the financial stressors that go along with that. We're dealing with current events, and it seems like every time you turn on the radio, turn on the news, go to the gas station, you're hearing about more people's opinions, and it's just like it just is an extra stressful time kind of across the board for everybody. So where normally, if on a scale of 1 to 10, you run from maybe a 3 to 5 on your stress levels, right now you're probably running at an average of a 7, 8, it seems like. So I think when you have to start worrying is when it starts to come out as irritability a lot, when it starts to impact your ability to sleep, your sleep schedules start to get kind of messed up. It starts to impact your primary relationships, where it's kind of getting in the way of you being able to access support or be support for the people that you care about and love. I think those are some good times. Any time that you start to have suicidal or self-harm thoughts, I think is a time that you need to be gaining support. So did I miss anything, anybody that? Okay. Those are kind of the ones that stand out to me. When it starts to get in the way of you being able to function in your daily life and your daily relationships, and you start to get really worn down.
Rio, can you talk a little bit about what we can look for in kids, as it presents a little bit differently in children than it does adults?
Sure. Kind of along the lines of what Carrie said, definitely look for those extreme changes in behavior with your children. And that's kind of across age groups, looking for those changes in behavior, the ability to cope day to day and sleep. But with younger children, you really want to look for persistent nightmares or not being able to sleep through the night, excessive worry, maybe looking to control things at home, like trying to clean things, or if some kind of routine that you have at home you aren't able to do, or you have a change in what you're doing at home, and that kind of just, throws them over the edge for the day. You want to look for some defiance, maybe aggression or more temper tantrums for those younger kids. For older children and teens, you're looking for more of that intense fear, maybe an inability to cope with daily problems. And so, like Carrie said earlier, that just functioning day to day is really hard. Maybe not being able to manage responsibilities. You see more defiance towards authority. Something else you might see is excessive physical complaints, maybe about headaches or stomach aches. And then looking for like a prolonged negative mood or attitude. But really looking at those significant changes in behavior across the board.
Thank you both, Rio and Carrie, for that. So one of the things that we wanted to continue to talk about is, how do you begin the conversation with someone that might be struggling during these times? It's really challenging to look at all the different sides of this, and it can be intimidating to talk to someone that is already having a tough time. So how do you talk to that family member, friend, or child that may be struggling at this time? Rio, can you talk to the kid side of things, and then we'll have Carrie talk from the adult perspective.
Absolutely. So children don't always understand or recognize their emotions or when they're struggling. So something we can do as adults is help them with that. So talking about your emotions, even just modeling, saying, here's how I'm feeling. It's really important to remember about children that their perception is their reality. And so sometimes what we don't think is a big deal or a trigger, or could cause a huge emotional reaction for kids. So some ideas for talking with children about mental health could include talking out loud about what you notice. So saying something like, I noticed that you're biting your fingernails. Are you feeling nervous? For younger children, something that I recommend is talking about feelings with something that they know, like colors or the weather. And then I also think it's really important to practice those coping strategies with your kids. And so that can look like saying, I'm feeling a little bit nervous right now or anxious. Let's go for a walk, or let's practice deep breaths together. Say what you're thankful for. And just talking through the things you can and cannot control, because I think for kids, that kind of recognizing what you can't control is really hard. And so then doing something that you can control together is always helpful.
Carrie, can you talk to the adult side of things?
Yeah, absolutely. And it lines up a lot with what Rio said, just on an adult level. I think the first thing that you do is just validate that, wow, yeah, it's a rough day. Or, in our house, I've got 2 teenage boys and my husband and I, and we have what we call COVID days some days, where it's just a rougher day than another day. And it'll be like, wow, I think I'm having a COVID day. And then I'm sorry, it may not have been that you didn't do the dishes, that my head popped and spun, it's being able to be real about that and validate that for each other, and to let somebody know that they're not in it alone. I think you're not in this alone. I'm having those feelings too. What do you need right now? That's a big question to ask another adult, or even teenagers, or even kids sometimes, because it could be a popsicle, or for an adult, it might be, I just need to get the bedroom cleaned up, or whatever it is that's going to soothe them, or I just need to go for a walk, but validating their emotions, letting them know they're not alone, that you're in it with them. I think those are probably the strongest tools that you have. And because once you build that connection, it just kind of brings all of that down a little bit, and you can move from that really intense emotion into some problem solving, or, moving into some of those coping skills together.
Well, and we all have seen the saying, it's okay to not be okay, throughout all of this. And it's really important that we all sort of give that extra grace to one another as we're dealing with the challenges in the different ways. As we're preparing for school, and there's still a lot of ongoing conversations about what the school year is going to look like, how the kids will be in the classrooms or at home. That's a really stressful time, not only for the adults in the household, but for the kids. So Rio, what are some ways that we can help kids particularly address that stress that's already adding to the mental health issues that we've got going on?
Yeah, I think that, talking to kids about mental health, there's a big misconception that we shouldn't talk about it in front of kids. And so I think that really does a disservice to our kids, because it kind of sends a message that you shouldn't ask for help when you need it, or that mental health is something that we shouldn't talk about. And so I think talking about, how you're feeling, or kind of walking through things with your kids is really important, especially when there's such uncertain times. And it's okay to say to your kids, I don't really know, but I know that you're safe and that you're loved and that I'm here for you. And I think that validation of safety is so important for our kids, so that they know, we're living in uncertain times right now, but I'm here for you, and we're going to get through this together, and talking about it.
I am multitasking. Just to remind people, you can ask questions in our YouTube chat. And if you want to ask questions in the Facebook discussion, we apologize for the technical issues today, but Facebook has had some off and ons all throughout the week. So please bear with us as we work through that, and send us your questions via Twitter or on YouTube, and we'll add those to today's conversation. So both to Carrie and Rio, what are some simple self-care steps that we can take during this stressful time to help sort of ease that? Carrie, do you want to start?
Sure. I think keeping routines in place as much as you can, I think, can be helpful. Making sure that you're getting good sleep, eating healthy foods, getting basic exercise, doing those things that kind of pour into you, pour into your family, pour into the people you care about. I think probably one of the biggest things is to have grace for yourself and the people around you during this time. And especially if you're like, okay, I need 8 hours of sleep, and I need to eat healthy, and I need to start a new habit, and I need to do a home improvement project. Maybe you just need to, get up and eat breakfast and put your pants on and go to work, and call that good. Or, it's kind of balancing out those healthy things and making them not so much pressure, but just kind of putting them in place as, oh, this is great, but then also having some grace with yourself. Does that make sense?
Rio?
Yeah, and just to jump off of what Carrie said, one of my favorite things that I've come across during this time is, it's an acronym, and I love acronyms because they help me remember things. And so it's RAIN, which stands for recognize, acknowledge, investigate, and nurture. And so recognize is just recognize that you're not okay, and take a step back and say, okay, something's wrong, and I recognize that in myself. Acknowledge, I think that we as people are so used to being busy and just chugging along. And so taking that time to acknowledge this is how I'm feeling and to let yourself feel your feelings or to have that emotion is so important. Because if we push it aside and just keep going on, it's going to build up and come back later. So recognize, acknowledge, and then investigate. I'm really big on looking at what can you control and what is outside of your control, because so many things right now are unknown and they're outside of our control and we can't really do anything about it. And it's so easy to spin our wheels trying to have plans A through Z. And so look at what you can't control and then what you can do. And that's where you would start to end, which is nurture. Doing the things that are going to help you. So like Carrie said, that might just be getting out of bed today, and that's good enough. And so doing the things that you know are going to help you take care of yourself. Maybe it's eating a good breakfast so that I can make it through the day. There's just doing the things that are going to help you take care of yourself. And self-care can look different for each person. And I think that's really important to know too, that what works for me might not work for someone else. I might really like yoga, but somebody else might think like, I just can't sit in silence for that long. And that's okay. You just find what works for you.
Yeah, I love yoga and meditation, but it's not very common with others in my household. So we all have to find the fit that works for us. We do have a couple questions from participants today. I think this kind of covers both Carrie and Rio. Grandparents may feel isolated right now because they can't go and see the grandkids like they had previously done. And some grandparents are in that particularly dangerous category of the vulnerable population for COVID-19 or are immunocompromised from a variety of pre-existing conditions. How can families help support one another's in the different generations?
I think that, you know, the situation that we're in is really hard, but it's given us this unique opportunity to find new and innovative ways to connect with each other. And I think that, you know, technology goes a long way. Being able to, you know, FaceTime or, you know, we're on a Microsoft Teams call right now, able to still collaborate and talk to each other, you know, writing cards and letters and sending them to your grandparents. I think that that's a great way to do it too. The possibilities are really endless. You just have to get creative. I know that I've seen like drive-by, you know, we love you and we miss you, social distancing. And so there are still ways to respect that. You know, there are some people in our community who are vulnerable populations, but they still need that connection. And connection is still so important for people. And so continuing to find ways to connect, even if it looks different than what we're used to.
And I think adding to that, I think sometimes the creative piece of that, how can we show grandma that we love her? Or for grandma or grandpa, how can I connect? You know, it can actually be that creative piece can be a way to do something for somebody you care about, which then is a really healing thing to actually be coming up with, well, ooh, I could send them, I could order a special something off, you know, a $2 thing off Amazon delivered, or like you said, I can drive by and honk my horn and wave at grandma. And those things, they take up time, but they also build the connection. And there is something really healing about doing something for other people. And I think that's a really cool piece of that too.
Great advice. So we are going to transition a little bit more into the challenging part of this. So we do want to warn everybody again that we are going to be talking about suicide prevention here with our team for the rest of this. So one thing that we want to make sure that everybody knows, there's a team in our community nationwide to support those that are in crisis. So we have on the call with us right now Heather Hayes and Officer McLaughlin, who are both on our crisis intervention teams and go out when we have those situations in which people might need a little bit more help. So one question that we have right now is, when should people seek professional help? Carrie, can you talk from the general perspective, and then Heather will talk about it from the more immediate perspective.
So general mental health support, definitely when your symptoms get to where they're interfering with your daily life, when they're interfering interfering with your daily activities, your relationships, your ability to work and get enjoyment out of things that you normally get enjoyment out of. Especially if you start having any self-harm thoughts, any suicidal thoughts, any homicidal thoughts. All of those are things that really are an indicator that it's time to seek out additional support.
Heather, can you talk about some of the crisis interventions?
Sure. Yeah, I agree with Carrie. Like right away, as soon as you feel like you need to reach out and talk to somebody, as soon as that stuff starts, because that's kind of a preventative measure. And I know folks that struggle, that's hard because people want to be strong and deal with things. But there are people that you can talk to, even just to talk. One of the nice things that I'm embedded with the police department, actually house at dispatches, people call the police that dispatch or the police that really do just want to talk or that don't know where else to call. And the nice part about my role is I have a direct connection. If you want to come to comprehensive, that's great, but I can still just talk and listen, even if I connect you to something outside. Our officers are wonderful, to listen and talk to too, but sometimes a regular person or social worker type person that maybe could connect you is good too. So yeah, right away, so that we can prevent a full-blown mental health crisis where 911 is called, and even if that happens and please come, it's not an automatic, necessary, we're going to the hospital, but right away so that we can get some supports in place, especially now, extra supports during COVID that could help prevent that mental health crisis, because a lot of people's supports have disappeared, especially with the elderly. Their home health people aren't coming, their kids aren't coming to see them, and they don't know what's wrong. And when you explain to them, I think that's what's going on, is that your supports have just, disappeared. So the sooner the better, for sure.
Well, that brings us to the important topic of resources in the area. So why don't we sort of start from the youngest and work our way up? Rio, can you talk about the resources we've got through the school system? Even when school's not in session, there's access to some of those needs.
Sure. So schools in general are equipped to teach students and support students in social emotional learning and talking about, our emotions and getting that foundation and groundwork. But when a student is in crisis, we have different staff who are trained to support those students. They're trained in mental health and crisis response. So in the independent school district, we have school counselors and school psychologists who are trained to help students when they're experiencing a crisis at school. And then additionally, we have family school liaisons, or FSLs, and they specifically work with families to get them connected to community resources and agencies, which I know Carrie's going to talk about in a minute. But all three of those roles work together to support the mental health of our students. And like you said, Meg, whether students are physically in school or virtual.
Carrie, can you talk from the adult perspective?
Sure. There are lots of resources that you can find, there are all kinds of hotlines out there. There's even a text line that's 741-741, a super simple text line especially for teens or even adults that are a little intimidated by picking up the phone and calling and talking to somebody. It's a new Missouri hotline, and I haven't talked about comprehensive stuff, sorry. But there's one, Show Me Hope. It's 816-836-6729. That's specific to COVID. And that they're going to connect you. They're going to either talk to you about the different stressors going along with COVID. They're going to hook you into community resources. Comprehensive is a community resource. We do outpatient therapy. We've got crisis services. We've got medication services. We have case management. We've got substance use services. So usually if we can't provide the service, we can at least point you in a really good direction on where to get that service in our area. and we love being that resource. So, never hesitate to call, because we will 100% refer you, either provide what we can provide or help you find that in the community that's going to work for you.
Well, and I do want to bring Officer McLaughlin in, who has been patiently sitting there. Our police officers do play an important role in the event of a crisis. So, Matt, can you talk to us a little bit about what that looks like in general? It depends on each case is very different, but what your role in all of this is.
Yeah, one of the biggest things I can say is if you call 911 because someone in your family is in crisis, if you think about it, remember to ask the dispatcher to send a CIT officer. And CIT stands for Crisis Intervention Team, as you spoke about previously. All of our officers are equipped to handle calls, but these officers have the additional training that can make a difference sometimes when someone's in crisis. Through that training, it gives officers a little more patience and understanding of what people in crisis are dealing with, and to how to de-escalate them better, to try to get them to understand and be willing to accept the services we can help them get into. And unfortunately for us, a lot of times if we're getting called, people are at their absolute worst, and things are usually pretty bad. So to be able to get through to them and get them into services is a huge asset.
Well, and that brings us to a very challenging topic of just talking about suicide in general. We as a culture have a lot of misconceptions about it, what it means, and can Carrie and Rio sort of talk about how to begin those conversations if you think someone may be thinking about or contemplating suicide?
I think one of the most important things to know is that it's okay to ask the direct question. It is, if you are concerned about somebody, there's kind of a misconception that if you ask the question, you might plant the idea in their head. And it's just simply not the case. The most benefit that you can be to somebody is just to ask them very directly, well, you said you just don't even want to be here anymore. What do you mean by that? Go ahead. Are you thinking about suicide? Are you having suicidal thoughts? Just asking those questions all of a sudden allows them to be very honest with you and allows you to know what supports to bring in for them. So I think, to me, that's probably one of the most important things, is to just go ahead, ask the question, and don't be afraid of the conversation.
Talking with kids is a little bit more challenging. Rio, how can we broach the subject with the different age groups?
I think that Carrie, explained it perfectly. I think that a lot of times with kids, we shy away from those, but if we have significant concerns about children, you have to ask the tough questions, and it feels really uncomfortable. But just kind of pay attention to how your kids are talking. Like Carrie said, if they're saying, I don't want to be here anymore, or kind of those vague things, and asking more like, what do you mean by that? I think that that's where we can get to the root of what the problem is. But just like Carrie said, I do think that you have to ask the direct question, or you're not going to be able to get the right support.
So Heather and Matt, this one's for you. We can ask the questions and do what we can to encourage them to get help, but when should you call 911?
I don't know if you're asking me, but and Matt can chime in. But if the person is at imminent risk, versus someone that struggled with suicidal thoughts their whole life, and they're just having a day with increased symptoms and increased thoughts. But if they're at imminent risk and they have a plan and they've thought of that and they have the means to carry out that plan, that's when, for me, or whoever, 911 needs to be called out, because we rely on, like Matt said earlier, those officers to come and, assess further and get that person to safety right away. So yeah, I mean, if you're worried about someone, have them call and have them checked on. And then sometimes I can come out, and if it's just a bad day where stuff has been increased, we can do some other plans to get person through the 24 hours. But it's that imminent risk. When someone says it, yes, yes, yes to all those questions. I've been thinking about it. I have a plan, and everybody has the means, quite honestly, to do it, but to do it, that's when they need to be called. Sure.
Matt, is there anything you would add to that?
I think what Heather said is very spot on. I think that it's important. If you have any doubt, we would much rather you call, we come out, and yes, if we can defer something to someone like Heather or one of our other community mental health liaisons or something like that, we will do that if need be. So when in doubt, definitely call. And I think it's important for people to know that we care and we want to get people the help they need. And I know sometimes people are leery because they think they're going to be in trouble or going to go to jail. On a mental health call, we're there to deal with the mental health issue at hand and get people the resources they need to get them through their crisis. So I think that's a very important thing for people to know.
Great advice. So mental health is something that we are going to be talking about through the duration of COVID-19. And at this point, we have no idea how long that's going to be. There are a lot of stressors as this continues on that are adding up. But when we see someone that is in crisis or maybe suffering with depression or anxiety, it can be really hard to have a conversation as a family. How can we talk to kids about the struggles that a family member might be having?
Kind of like Carrie and I have been saying throughout this, is that there's a big misconception that we shouldn't be talking about mental health with each other, and that's not true. We should be, talking about mental health can be as simple as sharing about all emotions, positive and negative, talking about challenges, saying, Meg, I think you said this earlier, saying it's okay to have hard days and it's okay to not be okay. But it's not okay to get stuck there. And so talking about how are we helping mom or dad or aunt or uncle to get out of being stuck there. So it's okay to say something like, I'm feeling anxious right now. Let's go for a walk. Let's take deep breaths. Like I said earlier, practicing those coping strategies as a family helps normalize mental health and that it's okay to not be okay, but here's how we're going to take care of it. Also, it can be hard to talk about mental health as a family, and there are so many children's books and videos out there about specific mental health conditions. And I think that those are great resources, not just for kids, but adults too, because those books are full of ideas for how to support your family member when they are dealing with something that you might not know a lot about. And so those children's books also can teach the adults and be a great tool and resource to use. And just like a Google search or, public libraries have those resources for you. So I think really just trying to figure out what's the most age appropriate way, but children's books are such a great starting point, I think.
Well, we are at our half hour here, but I do want to talk about the last two things really quickly. Carrie, you sort of alluded to it earlier, and there are studies coming out about COVID brain, where we are under this increased stress throughout the duration of this, and much like pregnancy brain and other things, they have found that there's actual data that support that this increased level of stress is causing additional fog and other things with our brain. So I want to talk about, again, just what that means and how we can give ourselves a little bit of extra TLC.
Well, I think it's kind of like what Rio said. You have to kind of figure out what works for you. You have to know what for you is going to drain off some of that. Whether it's going for a walk or, going for a hike. For some people, it's really intense working out, or for some people, it's yoga. For some people, it's falling into a Netflix hole and watching an entire series. And that's okay too. And I think the most important thing is to just, I loved, was it RAIN? Was that your acronym? Yeah, I loved that. Having that kind of, that mindfulness of acknowledging that this is what's going on, and then giving yourself some grace, and then taking some action to kind of drain off that stress in whatever way you know works for you, and helping the people you care about do that same thing. And I think those are some really good ways to kind of manage it right now.
So we do have a few questions from participants that I want to get to here. How can we help our kids prepare for the changes of back to school and the anxiety that that might bring?
Sure. I'm sure that a lot of kids and adults as well are feeling the anxiety of coming back to school, and that's okay. I think talking through how school might look different, or just thinking about things that you can do that kids can look forward to maybe after a long school day. So giving them something positive. I think too, just reminding them that, you know, even if the school year looks different, you know, their teachers care so much about them, and they're so excited to have them back. They're so excited to get to learn together again. And so maybe practicing those coping strategies too, you know, if you start to feel anxious at school, here's what you can do. And figuring out and talking together about what works for each of your children. And then reminding them, I know something that I do is I keep like a Post-it note in my wallet of my own coping strategies, so that I have this like visual reminder that's always there of, you know, when I start to feel overwhelmed as an adult, here's what I can do. And so I think that that's really important too.
Well, another question we've got in the conversation here is, how important is routine during these times?
I would say that routines are, you know, they are something that we can depend on. As much normalcy as you can have is great. But I do think that, you know, this whole situation has caused us to be flexible all the time. But I do think that routines are important, especially for children, knowing what to expect, but talking through, you know, when a plan changes, it's okay. Here's what we can do. But I do think keeping routines where you can, but also talking about, you know, sometimes we can't do the things that we normally do, and that's okay.
Yeah, I know I have a kiddo that struggles with transitions, and this has been very difficult to adjust his routine on a day-to-day basis. So again, as we've had Carrie and Heather and Rio all emphasize, give yourself some grace, because day to day it's going to change. The challenges are going to change, and we don't know what's coming next. So one final thing, what are the just closing thoughts, resources that you want to make sure everybody is aware of as we close off today? Rio, do you want to start?
Sure. I think that just one point to make is that, you know, when we talk about traumatic events, we think about maybe like a house fire or a car accident, but something about COVID is that we have all experienced this complex trauma together, because the end of it isn't very clear. And so just recognizing that, you know, we're all going through this thing, and we may all be experiencing different things. I know that Meg, you had mentioned that there's a saying that you like, that we're not in the same boats, but we're all in the same storm. And so I think that is such a valid description of what we're going through. Some of us feel okay, some of us don't, and we flip-flop too, and that's okay. I do think that, you know, finding a resource that can anchor you. So like that RAIN resource for me, if you search COVID RAIN in Google, it'll pull up this really nice visual that describes it. But finding those resources that you can anchor yourself to, so that when you're not okay, you have something that you can look back at, so that you don't really have to think about it when you're in the moment, overwhelmed.
Carrie?
I think also finding those connections with the people that you care about, and who care about you, or finding ways to care for even other people as much as you can in a safe way. I think those connections and that sense of purpose are so important right now. So I think kind of focusing on those things is going to be a really positive thing going forward. I think recognizing when you need to bring in outside resources, whether that's just, you know, a therapist or whether it's more intense services, whatever you need. I think accessing those resources when you need them or helping other people get connected with those is hugely beneficial right now.
Heather?
Yeah, excuse me. I wanted to piggyback off Curie a little bit. Please call. Like, and what Matt said, the officers will come and they will talk with you. I will talk with you. You can call Comprehensive's building during the day and ask for a crisis worker. The mental health crisis line is available to you 24 hours a day. The special COVID team is available. There's so much out there. I do a lot of outreach. I know Matt does a lot of outreach. I can safely come, and some people just need a quick visit, some human contact to talk and chat, especially the seniors that are completely out of the routine and very routine oriented. I'm happy to do that. I would rather be out doing that than in the office, to just make sure you are connected with someone, and just call. We want to help. The whole city wants to help. The officers want to help. Don't hesitate to call. If you're worried about someone, call 911 and talk about it, because this is the time everyone's aware that we need that now. So there's tons of people to call me directly. We can talk. Just wanted to reiterate that connection, especially talking to a lot of seniors, has really helped. Like, I've heard some, you know, I haven't seen anybody in a week, and it's like, oh my gosh. So we can make it happen. Like Rio said, we're extra flexible right now. So we can definitely make that happen.
Oh, great advice. Matt, do you have anything you'd add?
Yeah, the only thing I think I would like to stress is, you know, to keep in mind that the police department and the fire department, we have folks on 24/7. So that's when a lot of people get at their lowest points, it seems like, is, you know, at nighttime and stuff like that. So please reach out. We can get you through, and, you know, and if we need to, get you to an emergency room or a facility until daytime. But there are definitely services out there, and sometimes you may have to find the one that's right for you, but we can get you services that will hopefully help you through and make things, you know, back to what your normal was prior to the crisis happening.
It's all great advice. So one final thing, it is important to note that social distancing does not mean social isolation. So if you have family members or friends that may not be able to get out and about like they had previously, please call them. There are a variety of ways that you connect, be it through a Facebook group, through a Zoom meeting, through all sorts of other ways. Even just a simple phone call or talking to each other from the sidewalk and the door is a good way to get there. And we do want to make sure that everybody is aware of the different resources. So all of the numbers and websites, we'll collect those from our panel this morning and make sure that we share those both on Facebook and YouTube as follow-up to this. But again, an important reminder is, while we had a great conversation today with some really good insight from our panelists, this does not constitute medical advice. So please seek out medical attention if you need additional assistance. And as all of our panelists said, please do not be afraid to call if you need help and to have those conversations at home. Again, Rio, Carrie, Heather, and Matt, we really appreciate you joining us today. It was a great conversation, and we will continue these live sessions on other topics, but have a great day, everybody, and we'll get through this together.